with another Age Your Way with your local AAA. I'm here with my good friend Bob. We've spent a ton of time together as we've been at fairs and expos. But Bob, what is it that you do here?
So I manage our MAP group. MAP is the Michigan Medicare Medicaid Assistance Program. We are a statewide volunteer group that answers Medicare questions for everybody.
We have a lot more to learn about that, but it's fall. You can see out the window we've got Michigan leaves. So the first thing I think of when I think of fall is donuts and campfires. What about you, Bob?
It is open enrollment.
Knew you were going to say that. All right, so let's get into it. When someone talks about open enrollment, what do they think of?
So Medicare open enrollment is the main time each year that somebody gets an opportunity to change their prescription plans and their Medicare Advantage plans. These policies, they change from year to year. Medications that are covered change, pharmacy networks, doctor networks, all the coverage of these plans change year to year. And then from October 15 to December 7 is an opportunity for Medicare beneficiaries to review their current coverage, see if there's anything better, make a change, or if it's going to be just as good next year, they don't have to do anything, stay the same.
So the MAP program, can you talk a little bit more about that? Because that's like the heart and soul of what you do.
Yep, so MAP, Michigan Medicare Medicaid Assistance Program, like I mentioned, we're a statewide volunteer group. Here with Area Agency on Aging of Western Michigan, we are in all of our 9 counties. We have volunteers scattered throughout our region.
Okay.
All different locations. We have a core group here at the agency, but we have volunteers at senior centers, at commissions on aging, different locations all around the region to help answer Medicare questions for people. So,
does it cost anything to ask questions about Medicaid or Medicare?
Nope, no cost for people to give us a call. We are a free service. We are a federally grant-funded program. We are the state of Michigan, what they call a state health insurance assistance program. So each one of the states around the country has a program like ours. So here in Michigan, we go by the term MAP. But anybody can call us, Medicare beneficiaries, family members. We have grandchildren and helping out grandparents, professionals out in the community. Everybody with a Medicare question can call us. Easiest way to get in contact with us, especially for Medicare beneficiaries, they get their Medicare U-book every year. That should already have gone out in September. They flip that cover or the book over. On the back cover is our 1-800 number. So whatever county you live in, you call that number, you go to that local county. So easiest way to get in contact with us.
So while I'm watching Jeopardy, every other commercial is about Medicare or Medicaid, and we hear about scams. Can you walk through that with us, please?
You betcha. So with open enrollment time, while it's exciting and busy for myself and our volunteers, the worst part about it is all the TV commercials, all the junk mail that people get, all the unwanted 30 phone calls you get at dinner time. So some of the practices that we see that people should be aware of, cold calls, companies should not be cold calling you. The best way to protect yourself is to not give out Medicare information over the phone.
Like what? What would they ask for that you shouldn't give?
They are asking Medicare, that's the primary thing, is Medicare number. Usually the first thing off the bat that we see, people are asking for Medicare number. Once somebody has that number, they can do all types of stuff. They can change your plans. It can go even to the scary end of improper billing or maybe using your Medicare number for fraudulent activities. So the big thing is you want to protect your Medicare number, not give that out.
Good advice, Bob. Any other tips that you have during this open enrollment period where we can avoid scams?
Talk to trusted people. Our agency, our program, we're a trusted location. Call 1-800-MEDICARE for other questions. When people are trying to figure out what type of coverage they want, talk to your friends and family, neighbors, or other trusted people to see, different programs that are working for them. Just try to get an idea of the options that are out there. But at the end of the day, everybody should be at least reviewing their coverage to make sure what they have now is going to work for them next year.
If someone called, would you or a volunteer that works with you be able to help walk them through all of those scenarios?
You betcha. Yep. So the first things we look at when we're talking Advantage plans our provider networks, and medications. Those are the first two things that we talk about. So we help narrow it down, and then we start looking at all those extra benefits to find out, okay, hey, that plan's good, that plan's good. And then that helps, again, narrow it down even more so it's easier for the beneficiary to make that final decision.
We are so fortunate to have Bob at our agency. His wisdom, his years of experience, and all that you bring to people that come here, we just want to say thank you. And thank you for watching another Age Your Way with your local AAA, and we will see you next time.